My name is Jordan Saygraves, and this is my illness PowerPoint for FSHS 475, Introduction to ChildLife. The illness I was assigned for this PowerPoint is Down syndrome. There are many signs and symptoms of Down syndrome, including physical signs and intellectual signs. The physical signs are decreased or poor muscle tone, short neck with excess skin at the back of the neck, flattened facial profile and nose, small head, ears, and mouth, upward slanting eyes, often with a skin fold that comes out from the upper eyelid and covers the inner corner of the eye. White spots on the colored part of the eye, wide, short hands with short fingers, a single deep crease across the palm of the hand, a deep groove between the first and second toes. Even though physical signs are the only signs people really notice when they look at a child with Down syndrome, there are many intellectual signs as well, such as short attention span, poor judgment, impulsive behavior, slow learning, delayed language and speech development. Out of these, the ones that people notice the most are delayed language and speech development and slow learning. I think these are presented the most because that's what people first notice when they first look at a child with Down syndrome, and that's what their first interaction is, but they don't get to know them enough to see the other things that they do. To show you the signs and symptoms firsthand, I've included a picture. Here you can see the slanted eyes, the squished face, and the mouth that kids with Down syndrome have. Here you can see the upward slanted eye and the big groove between the first and second toe. Here you can see the big gash in the middle of the palm. Also on this, it shows the chromosomes that kids with Down syndrome have. As you can see, these are a little different than the chromosomes you and I have, which makes them different that they are. Medical conditions. Children with Down syndrome have an increased risk for many medical conditions, all which come with many trials and tribulations that the kids will have to deal with at the hospital. A big one for kids with Down syndrome is congenital heart defects. This could be anything that deals with the heart, such as holes or valves that don't work, and usually with this you have open heart surgery. Another disease or medical condition that they have is Alzheimer's disease. This usually happens later in life, so the preschooler kids I'm covering in this slideshow don't really have to worry about that. Another thing is respiratory and hearing problems. This is big for children with Down syndrome and important for ChildLife specialists to remember because they need to accommodate the children they're helping. Another thing for children with Down syndrome is childhood leukemia. This is the same leukemia that other people get, it's just harder for kids with Down syndrome because they may not understand why they have it. Thyroid conditions are a big thing too, where they could have surgery with that and get tested weekly or monthly by blood draws to check their thyroid levels. Diagnostics tests. There are two diagnostics tests that children with Down syndrome get. First is the prenatal, which is a CVS or amniocentesis. All the research I did showed that you really want to have the prenatal test done because it really helps the mother, father, and everyone else who's going to be involved with the baby's life prepare for the baby. It also lets you take the correct vitamins and do the correct tests that you need to do to take care of the baby to make sure they have a great life and have a safe birth. Some people don't want to test the baby while it's in the womb, so there's an afterbirth test for Down syndrome, which is a karyotype. With the karyotype, doctors draw a blood sample to examine your baby's cells. They photograph the chromosomes and then they group them by size, number, and shape. As you saw on the first slide, a baby with Down syndrome's chromosomes look different than ours, so it's easy to tell by the karyotype test. Like I said in the beginning, it's really recommended to get a prenatal test if you're concerned that your baby has Down syndrome. Prevalence of Down syndrome. As you probably know in your life, you know someone with Down syndrome, you know a family affected by Down syndrome, or you've at least come in contact with someone with Down syndrome, and that's because Down syndrome is pretty prevalent. The estimated incidence of Down syndrome is between 1 in 1,000 to 1 in 1,100 live births worldwide. Each year, approximately 3,000 to 5,000 children are born with this chromosome disorder. It is believed that there are about 250,000 families in the United States of America who are affected by Down syndrome. Life expectancy and demographics. The life expectancy for people with Down syndrome has increased dramatically in recent decades, from 25, which seems really young, in 1983, to 60 today, which is a huge gap, so it shows the improvements we've made and the ways we are able to help people with Down syndrome to live longer. Down syndrome occurs in people of all races and economic levels. The incidence of births of children with Down syndrome increased with the age of the mother. but due to higher fertility rates in younger women, 80% of children with Down syndrome are born to women under 35 years of age. There are approximately 400,000 people living with Down syndrome in the United States. I know before I did the research, a big myth that I heard was that older women give birth to children with Down syndrome. As you can see, that sometimes happens, but only 20% of the population give birth to children with Down syndrome if they're over the age of 35. But the 80% is under 35, which goes to show that anybody could have a child with Down syndrome. It just depends. Treatment options. Down syndrome is not curable, but there are treatment options to help the child live a better and healthier life. The treatment options are early intervention and educational programs. With early intervention and educational programs, you get special people to help the child with Down syndrome have a healthier life and development. These people are special educators, speech therapists, occupational therapists, physical therapists, and social workers. Like I said at the beginning of the PowerPoint, there's many physical disabilities and intellectual disabilities that people with Down syndrome have. All of these educators can help in this way, especially speech therapists, since language delay is an important part of children with Down syndrome. Occupational therapists also help because they help them with their motor skills, and physical therapists help with their gross motor skills. Treatment therapies. Treatment therapies for children with Down syndrome include physical therapy, speech-language therapy, occupational therapy, and emotional and behavioral therapy. As I mentioned above, these are very important for the children with Down syndrome to help with the delays that they have in their life. Speech-language therapy is important because they usually have hearing and language delays, which is really important to cover so that they can develop along with the children their age. Like I said before, Down syndrome is not curable, but there are drugs and supplements to help them live healthier, happier lives. Amino acids or drugs that affect their brain activity are the ones most commonly used for children with Down syndrome. Like I said, there's no cure, so this is just to help them live their life. Many people with Down syndrome have very different diseases or disabilities, and with these, there's many different devices that could be helpful for them. The main ones that I found after doing research were amplification devices for hearing, because like I said, they usually have hearing and language delays, bands that will help with movement, special pencils to make writing easier. Like I said, they have different hands than the rest of us, so they need things that accommodate them in that aspect. They also are available touchscreen computers and computers with large letter keyboards. Treatment options. As I mentioned, the three main things that children with Down syndrome have that they would have to have work on are congenital heart defects, childhood leukemia, and thyroid conditions. With congenital heart defects, there's usually a catheter procedure or an open heart surgery. The open heart surgery can fix anything that's wrong with the heart and help the child in the long term. With chemotherapy, it kills all the bad cells in their body and helps them to be healthier. With thyroid conditions, you can have thyroid removal surgery or medication. A big thing with thyroid conditions is that they're tested weekly or monthly to test their thyroid levels to make sure everything is okay so they don't have to do these things. Researches to explain Down syndrome to children. The age development that I've picked for my PowerPoint is preschoolers. I chose preschoolers because it's the age I'd really want to most work with and I feel like I connect to the most. I chose to do a book because I felt like there's not many people with Down syndrome covered in books, and it's nice to expose them to this and see that they're not very different from everyone else and that they're just like everyone else and can have books written about them. The book I chose is Why Are You Looking at Me? I Just Have Down Syndrome. I think this is an important book for children to read because it helps explain to the child that there's nothing wrong with them just because they're different. It's helping them to embrace being different and helping them to believe in themselves to make friends like any other child. With Down syndrome, they often compare themselves to the people surrounding them. So it is important that they feel that they are normal and other people have this disability too, an illness. So I think this book really encourages that and it would be helpful to explaining Down syndrome to a child. Social and emotional development of preschoolers. According to Piaget, a preschooler is in the pre-operational stage. During the pre-operational stage, preschoolers like to engage in magical thinking or symbolic play. During this stage, it is important to remember they cannot perform options mentally. So working with the preschooler with Down syndrome, you would want to do more hands-on activities with coloring or role-playing or fantasy play, and not do a lot of things like math or things that they really have to do mentally, because that's harder for them, especially in the development stage that they're going through. According to Erickson, a preschooler is in the initiative versus guilt stage. During this stage, preschoolers' imagination grows. During this stage, they also begin to take control of their environment. So preschoolers during this stage really begin to grasp their environment and explore the world around them, which makes fantasy play fun for them, because as they're getting to know the environment, they can incorporate things that they believe into that as well. Physical development of preschoolers. The common physical development of preschoolers is sex identification, skill control of movements, they have slower reaction time, and they're about half the size of a typical adult. The thing to remember with children with Down syndrome is that they are delayed, so they might not be up to par on all these things. They probably have sex identification and can tell the difference between male and female, but they will have an even slower reaction time, and they might not be the size of a typical adult because, like I said, Down syndrome children are different physically. How Down syndrome may negatively affect a child's development. Like I said, children with Down syndrome usually learn and progress more slowly than most children. This is important for ChildLife specialists to keep in mind, because they may try to perform tasks that are developmentally appropriate for the child. But as you have to remember, these children develop slower, so they might have tasks that aren't up to the developmental level that they should be, but that they're at because of their Down syndrome. Another big thing for ChildLife specialists to remember is that children with Down syndrome have sleep disturbances. This is important for a ChildLife specialist to remember, because if the child isn't sleeping, then they might need to sleep during the time you usually meet with the child, so your meetings with the child may be shorter, longer, or at different times that you're used to. So a ChildLife specialist will definitely have to be accommodating to that. Another thing that I mentioned before is thyroid problems. Like I said, weekly, monthly, or daily, they'll have to get thyroid tests and get a blood draw to check their thyroid levels. If it becomes a problem, they could have to have surgery, so you'd have to accommodate for that, and you'd also have to learn to prepare them for their thyroid level testing. Another big thing that may negatively affect the child's development is heart defects. If the child has to have open heart surgery or is on heart monitors, it may be hard to do the activities you'd like to do with them. So you need to be accommodating of their space and time and help them to do activities that they're able to do even if they're bedridden with heart monitors. Also, preparing them for open heart surgeries is really important so that they understand and aren't fearful of what is going to happen. Respiratory and hearing problems are another big issue with children with Down syndrome and can negatively affect their development. Being understanding of this and preparing tasks for them to do that aren't hard of hearing and are easy for them to do physically is really important, and ChildLife specialists need to remember that. Issues related to hospitalization. Each child with Down syndrome is different and may not present any of these, or may present all of these, or may just present some of these. The big issues related to hospitalization for preschoolers are they may express aggressive behaviors, separation anxiety still exists for them, so the child may only play with me if their parent is present. Since development is delayed, playing with fantasy thought may make explanations more difficult. Misunderstanding and misconceptions are bound to happen, and illness and procedures be perceived as punishment. The two big things that stuck out to me when I read this about the issues related to hospitalization are separation anxiety and that they may be perceived as punishments. Separation anxiety was important for me to see because it made me realize that I might have to have their parent do the things I like to do and have to have their teach the parent what to do so that the child is most comfortable and that they're getting the developmental things they need and are still feeling safe and calm for the procedures they're going to have. Another thing that stuck out to me, like I said, was that the illness and procedures may be perceived as punishments. This is important to remember because all children think any bad thing that's happening to them is as a punishment and means they deserved it. But your job as a ChildLife specialist is to help them understand that what they're going through is normal and that it might be painful, but it's going to be helpful to them in the long run, and it is not a punishment, and other kids their age receive these things as well. Developmental considerations for preschoolers with Down syndrome. A big thing to remember for preschoolers with Down syndrome is that they're visual learners. Like I said, doing mathematical problems would not be helpful because they're more visual learners. Reading progress is often above the mental age for language and verbal skills, and in many cases, children with Down syndrome can read at any age level. When I learned this was most shocking to me because like I learned, They're usually language delayed and delayed developmentally, but I thought it was interesting that they can read at age level. I thought that was really impressive. I think that's a great thing to keep in mind with ChildLife specialists, is that just because they have Down syndrome, you can still use the books you would use with any other children on the child with Down syndrome. Phonics instruction should not begin until the child has a slight vocabulary of 30 to 40 words, and they're very sensitive to failure. So it's a good thing to keep in mind so you're not too negative, and if they can't get something right away, you keep encouraging them and don't let them get discouraged so that they stop wanting to do it. ChildLife intervention. I've prepared 3 ChildLife interventions that I think will be helpful to children with Down syndrome. The first one is prep for open heart surgery. With this, I would explain to the child that they will be given magic medicine to help them fall asleep. While they are asleep, the doctors are very carefully going to cut them open and patch the holes in their heart with tiny little stitches that will magically dissolve. Then the doctors will close them up and they will have a neat scar. I would prep them for this by showing them on a doll what their heart looks like before and what it's going to look like after. I will have them draw on their own doll what they think their scar will look like and add their own bandages to it so they'll be prepared for after surgery. I think this will help them a lot because it helps them to be creative and use their magical thinking and creating their own doll and understanding that everything happens to other children too, so if it happens to their doll, it's okay if it happens to them. The second ChildLife intervention I've done is a prep for chemotherapy. With this, I would explain to the child that they are going to get an IV. I would explain to them the needle only hurts for a second and then it goes away and they are left with a tiny tube that dissolves medicine into them to help them recover. During the procedure, I would blow bubbles to distract the child, hold an I Spy book, or have their parent hold them to keep them calm. To prepare for this, I would bring in an IV tube to show them what it looks like and give one of their dolls or favorite stuffed animal an IV so they can prepare for what is going to happen. When I was hospitalized as a young child, I had a ChildLife specialist show me an IV on my stuffed animal, and it was still one of the only memories I have from that hospitalization. So I know the personal impact it has on a child and how much it will calm the child just to see that happening. The third ChildLife intervention I've prepped is a prep for blood draw to check thyroid levels, since that is a huge issue with children with Down syndrome. With this, I would explain to the child that they're going to feel a tiny prick from the needle and then it goes away. I would let them know a special tube is taking their blood to the doctors so that they can examine it, and that afterwards they get a fun sticker, Band-Aid, and